What PSA level typically prompts a prostate biopsy decision? When it comes to deciding whether to have a prostate biopsy, the level of prostate-specific antigen in the blood plays a key role. Traditionally, a PSA level of 4.0 nanograms per milliliter or higher has been the common threshold that prompts doctors to consider a biopsy. This level is seen as abnormal and suggests that further testing might be needed to check for prostate cancer. However, it's important to understand that this is not a strict cutoff. Different medical guidelines suggest slightly different thresholds. For example, the American Cancer Society generally recommends considering a biopsy if the PSA is 4.0 or above. On the other hand, the National Comprehensive Cancer Network suggests a lower threshold of 2.5 nanograms per milliliter. This more sensitive approach aims to catch potential issues earlier but can also lead to more biopsies that turn out to be unnecessary. Other organizations, like the U.S. Preventive Services Task Force and many European screening programs, often use thresholds ranging from 2.5 to 4.0 nanograms per milliliter. Some centers may even use 3.0 nanograms per milliliter as a cutoff. Lower thresholds can help detect cancer sooner but also increase the chance of overdiagnosis, meaning finding cancers that might not cause problems during a man's lifetime. Doctors also consider a man's age when interpreting PSA results. As men get older, PSA levels tend to increase naturally. So, age-adjusted reference ranges are often used. For example, a PSA level up to 2.5 nanograms per milliliter might be normal for men in their 40s, while levels up to 4.5 or even 6.5 nanograms per milliliter could be normal for men in their 60s or 70s. In some cases, additional tests are used to help make the decision. The ratio of free to total PSA can provide more information, especially when PSA levels are in the borderline range of 4 to 10 nanograms per milliliter. Other factors like symptoms, findings from digital rectal exams, family history, race, and whether PSA levels are rising over time also influence the decision. Typically, if a man's PSA is elevated, doctors will often repeat the test after a few weeks. This helps confirm whether the high PSA is consistent or possibly caused by temporary factors like infection, recent ejaculation, or prostate inflammation. If the PSA remains high, a biopsy might be recommended after discussing the potential benefits and risks with the patient. In summary, the PSA level that usually prompts a biopsy tends to be between 2.5 and 4.0 nanograms per milliliter. But this decision is always personalized, taking into account age, overall health, and other risk factors. Always consult with a healthcare professional to interpret your results properly and determine the best next steps for your health.